TrumpRx, Drug Prices, America. A political promise or calculated hype? Discounts or political hype?
This is not just another health update. This is a prescription drug shockwave rippling across the United States. A government-backed website, billion-dollar medicines, and a sudden promise that Americans might finally pay less for life-saving drugs. In February 2026, the Trump administration officially launched TrumpRx.gov, a federal prescription drug pricing portal that immediately grabbed headlines across Reuters, ABC News, CBS News, Stat News, and Fast Company. The claim was bold, almost unbelievable. Lower prices on some of the most expensive medicines in America, including Ozempic, Wegovy, Zepbound, inhalers, fertility drugs, and autoimmune treatments. TrumpRx is not an online pharmacy. It does not ship medicines. It does not prescribe drugs, and it does not replace doctors or insurance companies. According to official White House fact sheets, TrumpRx functions as a government-run pricing and comparison platform designed to show Americans cash prices negotiated under new federal rules. These prices are reportedly tied to international benchmarks, meaning the U.S. government is attempting to link American drug prices to what other developed nations pay for the same medicines. Within hours of its launch, TrumpRx became one of the most searched health topics in the country. Screenshots of drug prices spread across social media, showing discounts of 70, 80, even 90% compared to standard U.S. list prices. Wegovy, a weight loss drug that often costs over $1,000 per month, appeared on TrumpRx with prices under $200. Zepbound, another obesity treatment, showed massive reductions. Fertility drugs that normally cost hundreds per dose were suddenly listed at a fraction of price. But as the excitement grew, so did the scrutiny. Major media outlets quickly noticed something familiar: the design, the pricing format, the pharmacy comparisons. TrumpRx looked strikingly similar to GoodRx, a private prescription discount company that has existed for nearly a decade. Fast Company and Reuters reported that TrumpRx integrates pricing data powered by GoodRx's infrastructure. In simple terms, the government platform appears to rely heavily on the same pharmacy pricing systems that GoodRx already uses. This revelation sparked an intense debate. Critics asked whether TrumpRx represents a genuine breakthrough in drug pricing reform, or whether it is largely a government-branded portal repackaging existing discount data. Health policy analysts interviewed by Stat News and CBS News emphasized that many of the prices displayed on TrumpRx were already accessible through GoodRx coupons, especially for cash-paying patients. Still, the Trump administration defended the platform, arguing that TrumpRx centralizes information, adds federal negotiation leverage, and brings visibility to discounts that many Americans never knew existed. Officials stated that transparency itself is power, especially for uninsured and underinsured patients. And this is where the story becomes complicated. Experts caution that TrumpRx primarily benefits people paying cash. For insured patients, these discounted prices may not apply. And even when they do, purchases made through cash pricing often do not count toward insurance deductibles or out-of-pocket maximums. That means some Americans could actually lose insurance protections if they rely solely on TrumpRx prices. Despite this limitation, millions of uninsured Americans stand to gain. For CNAs, gig workers, freelancers, and low-income families without comprehensive coverage, TrumpRx may offer real financial relief. Reuters notes that even partial savings on chronic medications can change lives. The political implications are impossible to ignore. TrumpRx positions prescription drug pricing as both a healthcare issue and a political battleground. Supporters call it a long-overdue challenge to pharmaceutical pricing power. Critics argue it is more symbolism than structural reform. But one thing is undeniable. TrumpRx has reignited a national conversation about who controls drug prices: corporations, insurers, or governments. As of now, TrumpRx lists just over 40 medications, with officials hinting that more could be added in the future. Whether this platform expands, evolves, or fades into controversy remains to be seen. But the message is clear: Americans are demanding transparency, affordability, and accountability in healthcare. This is not the end of the story. This is the beginning of a new phase in the prescription price war, where politics, medicine, and money collide in the most personal way possible: the cost of staying alive.